Hey, Greg.
Hey,
Hey, I just wanted to check in with you about my hand.
yeah, I have a protocol almost written up for you, like it's partial, but I'm working on it. The gut thing kind of threw me for a little bit of a loop, so I'm trying to figure out exactly what's going on with that.
Okay. Did you when you scanned it or looked at it, did it look the same as my doctor thought?
I do see a little bit of a low grade, like I don't even know that I'd call it an infection. It's like mm, it's like there's too much of one kind of bacteria, not enough of some of the good ones. And so I think Palmarosa is going to do it, but where it's at, it's kind of down a little bit lower. Um, I think what's going to happen is you're going to not take it in water. You're probably going to have to make oil capsules. Like it needs
That
to get further down the digestive tract.
if I use whatever I use,
Yeah, you could
or
use olive oil or whatever, but just like have a little capsule, put a little olive oil in it, and then it's probably going to be Palmarosa, but I'm exploring some different types of thyme. Yeah.
okay.
Yeah,
So
the thyme.
I do have Moroccan thyme,
Mhm.
and I have been putting some drops in water. And this is what I've been doing:
Okay.
turmeric, ginger, and Moroccan thyme in the
Okay.
morning, like a couple of drops of each. So are you? Do you think I should do those in
Keep
capsules
keep doing
also?
those. No, those can just be in water.
Okay,
Like the overgrowth is the thing, like I'm trying to figure out, because sometimes you'll throw something at something and just because the substance is getting into the body, it doesn't always get to where it needs to go.
right, right,
And that's, I'm having a hard time figuring out how to exactly get it to your spot.
sure.
And so I think it's either going to be that, or I might have you mix the capsule. This is kind of weird, but like you'll wrap it up in some food, like even chew the food in your mouth and then put the capsule in your mouth and let it kind of mix in with the food and then take it in, because it can get like lower down in the digestive tract.
Use the food as a carrier.
Yeah,
Yeah,
exactly.
yeah.
Yeah. And
So
I'm
I do.
trying to make it not so complicated. So I've been exploring a few different things.
Sure. Um, so I wondered what I've read when you're using turmeric for it to be for it to activate,
Mhm.
you need black pepper. When you're taking the oil,
Yes, especially with the herb, the oils. I mean, it can, but for this, not so much. Like it still works on the body pretty good.
okay,
So because it's in a little bit of a different form with that. You've broken down a lot of the physical material, and so uh, with the herbs, you definitely do. But with the oils, like I've done it both ways, and I don't know that I can tell a big difference when it's in oil form.
okay. It does it when I take it, it does seem to do something.
Yeah, 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 yeah.
But I did want to ask about that.
Yeah.
Okay, and
So how is the hand doing? How is the arm doing?
well, actually, there's been a tremendous amount of on Monday there was, and over the weekend there was a lot of pain, and then Monday, sometime during the day, the pain started going away, and right now I can actually touch my finger. The swelling has gone down some, and there isn't as much pain in the finger. Like I couldn't touch it hardly before, and but another thing is the wrist is a little bit swollen and red just in one area on the uh, on the joint, and the thumb um, kind of comes and goes with like popping that joint in the thumb,
Okay.
but then it'll stop. You know, But another thing is I am totally changing my diet. Like
Okay.
I'm starting to juice. I'm um I'm trying to figure out, how to I used to eat a lot of fruits and now I have to stop that.
Yeah.
So it's kind of a big adjustment and a different mindset to go
Yeah.
focus more on vegetables, to get enough vegetables in.
Yeah. How is the psoriasis?
Oh, I'm glad you asked. So the spikenard Theralotion, I've
Uh-huh.
been putting it on the spots on the skin,
Uh-huh.
and actually it had gotten it's a lot of different places on the body now, but as I'm putting the lotion on, the redness is going away.
Good.
So it's acting like it's calming it down. And with the Theralotion, I do sleep a lot better, and I'm taking 1 or 2 drops of spikenard internally.
I think that the spikenard is going to be a big part of this mix, because the more that the psoriasis is flared up, I think that it's a really big contributing factor to the psoriatic arthritis. They kind of go hand in hand. And from what I can tell, like, I haven't treated this one. I've treated it a little bit, but I haven't treated it a whole lot through the years. But from what I could tell is, you don't have the arthritis a lot of times unless you have a big flare up. So, like, just treating it as the hand and the swelling is good, but we also have to treat the psoriasis and the thing in the gut. But I'm thinking that there's also a component in the, like, with the medulla vagus nerve kind of connection, where the inflammatory response is thrown off. And so I'm trying to, like, pull this together in a way where this can be like the psoriatic arthritis, like, package. And I don't quite have exactly the way I'd like it to be, the part about the joint capsule and the top layer of the bone. But I'm kind of coming to the place where we might just figure that out later, and let's just get this treatment rolling. But I'd like to be a little bit more solid with that joint capsule, and just reducing the inflammation in it. And the combination that I have still doesn't quite, like, get it. It might have to be an herb that we put in there, in combination with the oils. But
Okay.
I'm close. Yeah, I'm
Okay.
close. Yeah.
So let me ask you, you do have a class coming up uh, about the vagus nerve.
Mhm.
So would that be a beneficial class for?
I mean, that's going to cover a lot of things. That's going to cover, like, physical, psychological, and then the spiritual component. The the physical. I mean, there's a couple pieces in there that could address it. Because like, I'm being really super specific with how it handles, like, inflammation and how the body's responding to it. The other thing also is, like, stress levels. And there's different,
Yeah,
like, target spots that you look for, or at least I look for, with the sympathetic nervous system. Like, we know the lungs and the respiratory tract, we know the digestive tract, we know the cardiovascular system, we know the urinary tract. But other areas can contribute to, like, an overstimulation of the sympathetic response. And I think what I was coming to you was that part of what I was laying out was we're going to use the spikenard for the psoriasis. We're going to use the spikenard for like calming the body down and you know, it reduces body tension, helps you to sleep. But I was going to have you do a thing where you do inhalations on the spine and then on the brain, and probably a little bit heavier on the brain, and to keep going back and forth between the brain and the spine. And that will calm down part of that sympathetic response. And it plays a role in this whole thing, but not as directly as you would think. It's like many years ago, like I don't know, I was talking this out with an osteopathic friend of mine, and you know, I was making the statement to him, like, you know, sometimes there's just these conditions where there's just all these like weird random things happening. And, you know, I start going down the rabbit hole, and then I realize the connecting thread through all of this is parasympathetic activity. Like something's off with that parasympathetic part of the nervous system. And you almost like kind of drop the symptoms and just start like fortifying the parasympathetic nerves. So, you know, looking at your parasympathetic nerve, it's depleted, but everybody's is depleted. And it's really not that out of balance with the sympathetic part. But I would say both of those things together are also a bit diminished. And so I go back to calming down this component of sympathetic activity, because as we expand and increase the strength of the autonomic nerves, that there's going to be a much bigger imbalance. Like they're close to being more balanced because they're worn out. You know, does that make sense? And so as we strengthen them, there's going to be a big differentiation. But right now they're kind of like functioning as they are. So the spikenard on the spine and brain will help like even those things out in a way that as it expands and function and like it's basically being fortified, like there won't be the big differentiation. So you could use spikenard, you could use valerian, you could use vetiver, you could use rooskous, but I know you have spikenard, so just go with the spikenard. So that is going to be piece of your protocol, by the way.
Okay, so should I start, did you say inhale on the spine and then inhale on the brain? Is that what you said?
Yeah, but do 2 or 3 times the amount on the brain. Like when you kind of calm down the spine, the brain is going to start like letting things off and trying to recalibrate. So you'll have to spend more time on the brain than on the spine.
Okay.
I mean, these are things that we're going to be talking about in the vagus nerve thing.
Okay,
We're going to go through all the different pieces of the vagus nerve, but I'm glad to also talk you through things. Okay.
And so with that class, do you think it would be too much for the body?
I probably wouldn't do the spiritual part, which is going to be the last part of Sunday. That might be a little too much. Because like there we're going into like the first day is going to be all physical stuff. Then the first part of the second day, we're going to go into utilizing the function of the vagus nerve to like release old things that engage fear, anxiety, stress, things like that, which still falls into what we're talking about. But then when we do the last part, it's more about putting like patterns in the body for the nervous system to like integrate. And you know, it's only going to be like the last few hours of the class. And so maybe that part I would just maybe listen and don't participate or you know, leave and then do it later.
Sure. Okay.
Yeah.
All right.
But the
Thank
first
you.
like day and a half, you're pretty solid.
Okay, all right, thank you.